For Ibrahim Abdeldaim, spending time with his 2-year-old daughter Rahaf is the happiest part of his day. He struggles with depression after he lost his legs in an Israeli strike on the United Nations school he and his family were sheltering in during last year's war. Abdeldaim's father and brother were killed in that strike, and Rahaf still has bits of shrapnel lodged in her skull.
I am completely destroyed. I've lost my legs. I've lost my job. I can't leave Gaza because we're under siege on all sides. All I want is at least one artificial limb to feel like a normal person again.
Once a week, Abdeldaim travels to this clinic in Gaza City. It's where he receives physiotherapy and is taught ways to manage his pain. But, like many of the thousands of Palestinians who were wounded during last year's war, he either can't afford to buy the medicine he needs or the treatments are not available. Aid agencies say the continuing impact of last year's war on Gaza's wounded is nothing short of catastrophic. 17 hospitals, 56 primary healthcare facilities, and 45 ambulances were either damaged or completely destroyed, costing the healthcare system here an estimated $50 million. According to the United Nations, 2,251 Palestinians were killed in the fighting, mostly civilians. Of the more than 11,000 wounded, at least 10% now have permanent disabilities. But there could have been many more survivors. An investigation by Gaza's Ministry of Health found 500 of those who were killed during the conflict should have lived. But obstacles including military zones, Israeli checkpoints, and a lack of coordination meant these individuals, all alive when reported to ambulance services, either died before the paramedics got to them or before they reached hospital. Mohammed Douema is a physiotherapist at one of the few rehabilitation centers for amputees in Gaza. He says the healthcare system was already stretched after the 2 previous conflicts with Israel.
Because, there is a siege from Israeli, or there is a close of border from the Egypt, because that we cannot bring the medication or bring the medical teams from abroad to make a treatment here in the Gaza Strip.
Which means the thousands of Palestinians like Ibrahim Abdeldaim who've been seriously wounded will continue to suffer. Imtiaz Taib, Al Jazeera, Gaza.